We now go to the gentleman from Texas, Mr. Farenthold.
Thank you very much. Dr. Gruber, you have the dubious distinction of having generated more buzz in the district that I represent than anybody but Eric Holder when coming up before this committee. And so I apologize if some of my questions are disjointed. Several of them come from Twitter, from folks who wanted me to ask a question. One I got was, why won't he answer the question? But I'm going to translate that more into, put my lawyer hat on and re-ask that. With respect to questions about the money that you made consulting on Obamacare from the both Federal and State government, you've constantly lawyered up or not answered the questions or not recalled. I want to be perfectly clear. This committee has government-wide jurisdiction. We are the taxpayer watchdogs. I am asking you right now, flat out, to provide a detailed list of every penny of taxpayer money that you have made from the government consulting on Obamacare, be it from the Federal government, be it from the State on a federally funded grant, or from a State. I am asking you to provide that within 30 days. And I would look forward to you providing it to the committee, and we'll work with Mr. Chaffetz, the incoming chairman, to subpoena that if it's not supplied voluntarily. So let me go on to a couple of questions. Do you feel bad about taking all this money from Obamacare from people you call stupid?
The money that I received from my economic consulting work was compensation for the quality work I did in economics and modeling, and so I think it was appropriate.
Okay. You worked, you had 21 meetings at the White House. You met once in the President's office. You talked to him. Based on the information you provided, things you heard in this meeting, these meetings, and your general understanding, do you believe that the administration was truthful and transparent in the things they said working up to the passage of Obamacare, like if you like your health care, you could keep it?
I believe that the discussion of the Affordable Care Act was fully transparent, and there's enormous discussion of all of the aspects of the law.
Do you feel like, well, you know, you testified earlier that you knew there was going to be some churn. Do you feel like you were complacent in presenting the Affordable Care Act in a dishonest or untruthful manner, and is that something you would like to apologize for as well?
The numbers that I presented as part of my economic modeling to the administration and Congress were all to my best of my economic modeling.
But you knew some of the things that the administration were saying, some of the things in the debate were not true. Why didn't you raise a red flag? Wouldn't that make you complacent?
I'm not a political advisor. It's not my job to discuss what the President's saying or not saying.
Let me just, this is another question from Twitter. Did your insurance get more expensive? Are you paying more for it, or did your deductible go up?
Health insurance costs in America have gone up every year for the past 50 years.
Did yours go up substantially more when you fell under the Affordable Care Act than it had in past years?
No, it did not.
Mine sure did. Let me see, where else do I want to go? When you were talking to Mr. McHenry, you said that the Affordable Care Act did not solve the problem of rising health insurance costs. You went on to say that it was a first step. What are the next steps?
The next step really, in my view, is to learn from the first steps that are implemented by the Affordable Care Act, to learn what's working, what's not, and to try to build on that towards stronger cost controls in the long run.
So if you were to sit down and write a new Affordable Care Act 2.0, what would be the top 2 or 3 things you would want to include in it?
Right now, the number one thing I would say is that we need some time to see what is happening with what we did in Affordable Care Act 1.0, to learn from that, and then to not be in a rush, but rather to sit down having learned from that and take the next necessary steps.
Would you consider the ultimate solution to rising health care costs to be a single-payer or government-run system, a completely government-run system?
I don't think there is a single ultimate system to rising health care costs.
All right. Now, you've also been thrown under the bus by the President as just another advisor. I think I would be insulted by that, based on certainly by the Washington Post article that said how key you were to that. you want to come clean and just tell us if you told them any of the things that they were saying were untrue and who you told and tried to stop them. I guess that kind of loops back into my, my complacency question. Could you have stopped some of those untruthful statements, and why didn't you? And would you like to apologize for not doing that?
I'm not a political advisor.
All right. Well, I'll yield back. Thank you, Mr. Chairman.
I thank the gentleman. We now go to the gentleman from the Massachusetts Institute of Technology, Mr. Massey, and Kentucky, for that matter, too.
Yes, Kentucky. Thank you. It's been a bad couple of months to be from MIT, thanks to one of our witnesses. I've reviewed your extensive and impressive curriculum vitae. It's 17 pages long. And would it be accurate to say that you chose economics, particularly the field of economic models, to inform public policy as part of your career?
Certainly, one of the things I find appealing about economics is how it can help make informed public policy.
So you're in a position of trust. You've been to the White House many times. You've met with the President. Could you tell us again what you met with the President about?
I had one meeting with the President. There were 6 experts and about 15 other members of the administration.
And you were an expert on how to control the costs?
Yeah, how to control costs and also to discuss health care reform in Massachusetts. And
was Independent Payment Advisory Board part of that discussion, or is that something that you would be an expert on?
I don't believe the Independent Payment Advisory Board idea existed at that meeting.
Okay. But you're very well aware of it and advise politicians on that?
I'm aware of the Independent Payment Advisory Board, yes.
So given this position of trust and the fact that you take taxpayer money, I have a question for you. Have you had any ethics training at MIT or Harvard?
As a condition for receiving Federal grants, we have to take a human subjects test.
So
A number of ethical issues.
And MIT has an ethics policy, correct?
Yes.
Okay. So this is a little bit philosophical, what I'm going to ask you now, but you're a doctorate of philosophy, so to speak. Under what circumstances is it ethical to deceive someone for their own benefit?
I'm not aware of circumstances in which that
Could you imagine maybe an adult could withhold information from children for their own benefit?
Yes.
Would there be ethical? Now, so if you understand that, then you understand why my constituents are so offended by your proposition that it's okay to deceive or obfuscate for somebody's benefit. Compounding the insult that you delivered to them is the fact that they pay your salary. So do you understand fully why it was so insulting? You patronized them. You were condescending.
I was.
And,
I agree.
And my colleagues on the Democrat side of the aisle are upset with you simply because you committed candor. You said what you thought. You said what they were all thinking when they wrote Obamacare, that they knew what was best for my constituents. I submit to you, my constituents are not your children, and they have the right of self-determination. So this gets me to another instance where you committed candor. In 1997, you co-authored a paper entitled Abortion Legalization and Child Living Circumstances, Who is the Marginal Child? On page 20, you conclude that abortion legalization appears to be associated with an improvement in the average living circumstances and birth outcomes among a birth cohort. And on page 26, you state that your research indicates that the legalization of abortion saved the government $14 billion in welfare payments through 1994. Is providing more access to abortion, is that a worthy social outcome to achieve cost savings for the government?
That is not what my paper was about. It wasn't a philosophical paper. It was about empirical facts.
Tell me what you meant by this sentence. By 1993, all cohorts under the age 18 were born under legalized abortion, and we estimate steady state savings of $1.6 billion per year from positive selection. What did you mean by positive selection? Because in this paper, you're talking about providing more access to abortions to a socioeconomic strata of our constituents.
What the paper did was look at—
What did you mean by positive selection in abortion?
In that paper, we were studying the characteristics of children who were born before and after abortion was legalized. By comparing those characteristics, you can infer the characteristics of the kids who were not born.
What you inferred, I find chilling. What you inferred is that if we reduce the number of people or children born, life will be better for the rest of us still living. Specifically, you seem to suggest that if we eliminate or reduce the number of poor people that are born, this will make life better for all Americans. And this gets me to my final point, which is the Independent Payment Advisory Board. My constituents fear that this is, in fact, a method by which Obamacare will ration health care for the elderly and therefore implement cost savings for Medicare. So my question to you is, does your philosophy on abortion, that it can save money and improve outcomes, have any implications in the realm of end-of-life care? You argue that abortions of poor children raise the average living circumstances in your paper for the rest of us and save the government money. So, Dr. Gruber, if there are fewer elderly people, particularly poor elderly people, wouldn't that save a ton of money too? As an economist, wouldn't you think that would save money too? And do you understand the dangerous implications of going down this path?
I have no philosophy of abortion. I have no philosophy of end-of-life care. My job as an economist is to deliver the empirical facts so that you all can make the necessary
And what would your
decisions.
facts be on the elderly?
I don't understand the question.
The end-of-life care. Do you advocate that the Federal Government should ration that?
No, I do
As an
not.
economist, would it save money?
I do not advocate the Federal Government should ration end-of-life care.
Thank you. I yield back.
I thank the gentleman. We now go to the very patient Mr. Meadows.
Thank you, Mr. Chairman, and it has been a privilege to serve under your leadership, truly an honor. Dr. Gruber, I'm going to come to you because you have made over 20 statements this morning that you are not political, and yet I think the American people, if they're viewing this morning, they would see your testimony is political. It is contrived, it is orchestrated, and honestly not transparent. You have prepared for this testimony this morning with your counsel, is that correct?
Yes.
How many hours does it take to be transparent and honest of preparation? How many hours of preparation does it take to be honest and transparent with the American people?
I don't understand the question.
Why would you have to practice your testimony in order to give an honest, transparent answer to the questions posed to you today? Why would you have to practice? Because you have practiced, because you've said the exact same thing, glib, those words, you know, they're not heartfelt. You've practiced that, haven't you?
I have practiced, but I disagree that they're not heartfelt.
Okay. So let me ask you about your economic model, because you said it was accurate. So how many, in your economic model, how many Americans would lose their health care, could not keep their plan as the President promised under your economic model?
I don't recall the exact number.
So you can recall all these other figures, but you can't recall that one?
No, I can't.
Okay. Well, can you get that to us?
Once
Oh,
again,
you don't want to get that to us?
that depends on—
Can you get us the number in your economic model of those that were not going to be able to keep their health care? Simple yes or no.
I don't know.
So you don't have it in your model.
I don't know whether I can or not. You'll have to take that up with my counsel.
Mr. Chairman, I see this witness as being very reluctant to give honest answers, and it is very troubling, not just to me, but to the American people. Ms. Tavenner, I'm going to go to you because the administration didn't want you to sit beside Mr. Gruber because they were afraid that his lack of transparency would be contagious, I guess, or you would be viewed in a different model. I'm troubled because I asked you some questions at the last time you appeared before this committee. And I asked you at that particular time about a rollout, and we went back and forth, and why did you not delay it? And your response to me, it says from Ms. Tappert, well, I didn't think it was possible the way the FFM was configured to do that, nor did I think it was necessary. Do you stand by that today?
I stand by the fact that I felt we were in good position to roll out last October.
Okay, yeah, I'm in, and I'd ask if you could put up the slide, if the staff could put up the slide, but I'm in possession of an email stream from your second in command and Mr. Todd Parks that goes back and forth. This email stream was less than 48 hours before rollout. It was on September the 29th. And in that, it says, just so we're clear, Ms. Tavenner decided in January that we were going to go no matter what. It goes on even further to says that hence the really cruel, uncaring march that has occurred since January when she threatened me with demotion or forced retirement if I didn't take it on. Are you familiar with this email?
I was not copied on that email. I have since seen that email.
All right. And so your number 2 person, because in the email stream, if you've read all the stream, it was indicating that you weren't ready, and yet it didn't really matter.
I don't happen to agree with that.
So it does matter. So in that same email stream, we were putting together hardware. We were installing hardware less than 48 hours before a rollout so that we wouldn't have a crash on the rollout day. Did you not see that as troubling? That we were installing, with less than 48 hours to go, we were installing hardware that wouldn't be tested.
We were installing hardware to increase capacity.
Oh, right, I got the numbers, and so, but you don't see that that's troubling when you're rolling something out that you wouldn't be ready when you're going to put in a piece of hardware just less than 48 hours?
We had tested, and we were increasing our capacity to handle more volume.
All right.
I would not see that as troubling.
And so this Ms. Snyder, is she with you today, or she was forced to retire?
She was not forced to retire. In fact, during the
Is she retired?
She is retired. Her choice.
She just wasn't forced to retire.
She was not forced to retire.
All right. Let me close by this. I sent your staff the information with regards to almost 4 million people that if they do not re-enroll will get hit with a tax bill some 10 to 12 months from now if they do not, because their benchmark plan has changed. Are you notifying those almost 4 million people that they may get a tax bill if they do not re-enroll individually?
We are individually notifying folks about the
Well, that's
importance of
funny
coming
because
in.
I have 17 counties I represent, and not a single one of them have gotten individually notified that they're going to get a tax bill.
So they are individually notified that I did not get a chance to finish my sentence.
Oh, I'm sorry.
Yes. They have been individually notified that they need to come back in to return to the marketplace to update their information and make sure that, A, their information is current, and B, that they're selecting the plan.
That's a general marketing thing. You already
No, it's
responded to
not a
that.
general
Well,
marketing.
it is,
It's
but
an
let me tell you.
individual letter and phone calls to.
But individually, you know who is going to get a tax bill. You know that today if they do not re-enroll. So why do we not notify them that if they automatically renew, they will get a tax bill?
Well, first of all, I don't know that that's necessarily true.
Well, talk to Dr. Gruber, because it is part of the plan that your premium, the rebate you get, whether your income changes or not, is based on selecting the benchmark silver plan. If the benchmark plan changes, and I would think that you would know that, you're over this, if the benchmark changes, then indeed the amount of money that you get back will be incorrect.
So the benchmark is just one thing that changes, right? There's lots of other things that can change, that would change your tax liability or your tax.
I understand that. But what I'm saying is someone who makes the same amount of money, stays on the same plan, got a rebate this last 11 or 12 months, they will get a tax bill unbeknownst to them by doing nothing.
I think that You're assuming, I assume you're talking about 2016, not 2015.
No, this open enrollment period right now.
That's not true.
Oh, and why is it?
Because
Because I'm all ears. I want to tell the folks.
First of all, the individuals who signed up in 2014, if they have a tax liability or tax credit, that will be in April of 2015.
I understand that.
Individuals that you're talking about now who are signing up for 2015, if they were to have a tax liability at all, it would be in April of 2016.
That's correct. But that's what I'm saying. They're going to get a tax bill if they do automatically renew by February. If they don't,
Not necessarily. It depends on
so
what's
they
going
can
on
change
with
their plan
individual.
after February.
They cannot change their plan after February, but whether or not they have a tax liability is going to depend on each individual, which is why what you are trying to say is a part of what we are stressing to individuals. Come back, update your information, look at a plan, shop, select. But when they did their original plan, they also understood that they are to update income, changes in family circumstance. There's lots of things that can affect it.
I understand that.
That's all I have.
But what I'm saying is the benchmark plan in the counties I represent will change because it's a different carrier. If they do not go in and select the new plan,
Well, first of all, if they don't select a new plan, we don't move them to a new carrier.
right, they will be automatically renewed. I appreciate the patience of the Chair.
No, and I appreciate the gentleman from North Carolina. I think the gentleman made the point that every American has to, independent, because he or she is not getting this information from CMS, they have to independently ask whether or not they're getting into a tax booby trap, into a tax landmine by just automatically renewing. And I think the gentleman's point is good. I'm afraid Ms. Tavenner doesn't want to admit that some people are simply not going to know, and she said, rightfully so, well, it's their responsibility. Well, it was never somebody's responsibility to know that they might be getting into a tax consequence before the Affordable Care Act. They now need to know that. We now go to the gentleman from Michigan, Mr. Bentivoglio.
Could I answer that? Because I think you'll.
No, ma'am, you may not. I was no question there, honest. I was
There's
simply talking.
piece of it missing.
I was talking to the gentleman. We'll give you plenty of time. We're not going to end this thing until you've had all your say, ma'am. The gentleman from Michigan.
Thank you very much, Mr.